So the question is about how are we using smart technology and AI. I will. There are three different ways in which we use technology, and for a couple of them, we are very different from other hospitals. So, like many other hospitals, we use AI that is available in the marketplace, commercially available AI, to help our doctors with diagnosis. So, when a doctor does endoscopy, AI tools can help them to find polyps, abnormalities that the doctor may not see. Similarly, you heard about stroke. When a CT scan is done for a stroke patient, we can use AI to quickly detect stroke and find out how much of it is reversible. So these are tools that are already available commercially and we use them. And Apollo has always been one of the first adopters of this tool. I think there are a couple of areas in which we are very, very different. We are not just consumers of these technologies, we are actually building these technologies. So as an example, we used our data on patients with liver ultrasound to predict liver fibrosis years before it happened. And it is very, very particular in the Indian population, so all the vendors don't have it. We then licensed it to a vendor who is out of Germany, a very large equipment vendor. We worked with the government to quickly screen chest x-rays for evidence of tuberculosis. That was a partnership with Google. So we are not just consumers of technology, but we actually help to build that. This smart hospital, as I said, will have a command center that is in real time monitoring all of the data for all patients. That is technology that we work in partnership with Microsoft. I think the last thing I want the media to understand is AI is not a magic bullet. AI is today very, very imperfect. And especially when you use AI for taking care of patients, it is not perfect tool. The advantage of the quality systems that Apollo has put in place is that we can now bring that level of governance to how to use AI. I think this is very, very important. And when we use AI at the website, when we use clinical AI, we have the right governance systems, and that is a system that Apollo has built over 40 years.
In terms of expansion, we believe that Pune deserves not just one hospital. Definitely deserves another. And as you look at urban cities in India, we are looking at micro markets. So definitely, if we are looking at another property, there is a come up with the hospital. And Apollo believes in building networks of care. So if you have a cough or a cold, you don't have to come to the hospital. We'll be setting up clinics for primary care. We already have a daycare center, so we have a daycare center. And of course, we have 60 pharmacies, but those numbers are growing very rapidly. In fact, we have 7,000 all across India. So you have a network